Okay, today we are going to be performing an eye assessment. This is my patient here. I will go ahead and close the door first for privacy. Next, I'm going to go and wash my hands and gather my equipment. And I will be wearing gloves for this eye assessment. Next, I'm going to go ahead and introduce myself to the patient. Hi, my name is Meredith, and I will be your nurse for today.
Hi,
Can I go ahead and have your name and date of birth?
my name is Catherine Garcia. My date of birth, January the 1st, 1965.
Okay, perfect. We have the correct patient. Today we are going to be performing an eye assessment. Do I have your consent to go ahead and follow through?
Yes.
Perfect. You can go ahead and remain seated in this chair for the duration of the exam. I have gathered my equipment here. I will be using this ophthalmoscope for the eye assessment, and I do not have a Snellen chart, but I have this magazine that I will be using for the patient to read. So first we're going to go ahead and get started by inspecting the external structures of the eye. I am looking here for symmetrical eyes and the eyebrows. Make sure they are symmetrical in both. I'm going to go ahead and pull the lower lid down, check for redness. Good. I'm going to pull the upper lid, make sure there's no abnormalities. I'm checking the eyelashes for even distribution in both. Good, evenly distributed. Next, I will be inspecting the overall appearance of the eyes for any protrusion or sunkenness. There seems to be none, so that is good. There's no abnormalities. They're not excessively protruded or sunken in, which could indicate an underlying condition or disease. Next, I will be looking at the lacrimal ducts here and the lacrimal apparatus. I am inspecting it for any redness or drainage or just maybe any sign of infection. I am also checking for any scaling. There's no scaling. There's no lesions. No excessive drainage or watering in the eye, which is good. Everything looks good there. I'm assessing for the overall skin condition. Make sure there is no peeling or abnormalities that I can see with my eyes. Next, I will be using my ophthalmoscope here to assess for the internal eye structures. We will start off by assessing the cornea and the lens of the eye. You can go ahead and look straight ahead. You don't have to stare at the light. I'm inspecting it for it's smooth and clear. Any cloudiness would indicate a potential cataract or the beginnings of a cataract. So they look smooth and clear in both eyes. No abnormalities. Everything looks good. Next, I will be assessing the iris and the pupil. The iris and the pupil, I am inspecting to make sure they are symmetrical. The size is symmetrical in both eyes, and the shape is normal and even in both eyes. So good, everything looks normal. Next, I will be inspecting the conjunctiva and the sclera. I am inspecting to make sure that the conjunctiva is clear and the sclera is the white part of the eye, which I'm making sure the color is evenly distributed. There's no discoloration or lumps or broken blood vessels. Go ahead and look down for me. Okay, good. No discoloration, there's no bruising, nothing that stands out to the eye. Next, I will be testing for any lag to her lid, any delay. So go ahead and look down. Okay, good. Her lid had no delay, no abnormalities there. There's no lid lag, which is good. There's no swelling, there are no lesions, there's no redness. Everything looks normal. Next, I will be inspecting, or I will observe the retinal vessels of her eye. So I'm checking to make sure her vessels are evenly distributed, and there's no broken blood vessels, which could indicate maybe an injury or an infection. Look down for me. Okay, good. Good. They are evenly distributed. They're all over their eye, so they're hard to miss. Next, I will be inspecting the red reflex. Now this, I will be using the light of the ophthalmoscope. The red reflex checks for a red reflection in the pupil of the eye. So go ahead and look straight. Good. There is a red reflection in both of her eyes, which indicates If it wasn't there, it could indicate paralysis or an abnormality to the inner eye structure of the pupil. So everything looks good there. Okay, next we're going to move on to a series of tests to test for your visual acuity, to test your vision fields and your eye muscles. We're going to go ahead and start off with the confrontation test, or not the confrontation, the cardinal test. This test will test the diagnostic positions. There are 6 positions which also test the 6 muscles of your eye. So the cardinal test, we're going to start off by, you're going to go ahead and stare at this, follow the pen with your eyes by keeping your head very still. Okay. Okay, good. Her eye movement was symmetrical and even. There was no delay or oscillation to the eye muscles, which could indicate an nystagmus. So that is good. No nystagmus was present, and all 6 diagnostic fields were tested. So no abnormalities there. Next, we'll move on for the accommodation for the pupillary constriction and convergence of its axis. So we'll be using this pen again. You're going to go ahead and follow the pen with your eyes. And I am looking for constriction of the pupil as it moves closer, and then dilation of the pupil as it moves further away. Okay, good. It constricted and dilated appropriately. Everything looks normal there. Next, I will be using the light on the ophthalmoscope to test for the pupillary light reflex. You can go ahead and stare straight ahead. And I am testing to make sure your pupils constrict when light is applied. Good. Constricted there. Good. Both pupils constricted symmetrically and at the same time. No delay, no abnormalities. Next, I will go ahead and test your corneal light reflex. Now this tests for the reflection of the light in your eyeball to make sure it's symmetrical in both eyes. Go ahead and stare straight ahead. Okay, good. The reflection was the same spot in both eyes. If it wasn't, that could indicate paralysis or an abnormality deep within the eye. Next, we will go ahead and do the confrontation test. The confrontation test, we will test for the peripheral vision of the eye. So you're going to go ahead and cover your left eye, and I will cover my right eye. And you're going to go ahead and tell me when you see the movement of my fingers, okay?
Mm-hmm. Okay, right there.
Right there? Okay.
Right there.
Right there. Okay, go ahead and cover your other eye.
Right there.
Okay.
Right there.
Okay, good. It was symmetrical and the same in both she covered both eyes, so that is good. And her peripheral vision is good, same as mine, normal. Next, we will go ahead and we will be using this magazine for her to read. You can use this note card to go ahead and cover your left eye first.
Okay.
I'm going to ask you to read out a series of numbers, okay?
Okay. 42, 20, 50, 89.
Good. Now go ahead and cover your other eye. Okay, go ahead and read out these numbers.
2, 11, 25, 38.
Okay, perfect. Good. She read all the numbers correct. So her visual acuity is good, normal. Next, we will go ahead and do the cover and uncover test. Now, this test is a test for her even alignment in both eyes as she focuses on an object. This object is going to be me in this case. So go ahead and cover one of your eyes. Okay, look at me. Now go ahead and uncover. Okay, good. She was staring straight at me. Now let's go ahead and do the other eye. Look straight at me. Uncover. Okay, good. Both of her eyes were able to latch on to me as a subject and focus. So there was no laziness, there was no lazy eye. They were both evenly distributed, evenly aligned, not distributed. Okay, and that pretty much concludes the eye assessment for today.